Hello, everyone. This is Tracy Schroyer, and I am a breast cancer survivor. And I want to share another video episode, I guess, within this series to talk about my breast cancer journey and the experiences that I had. I feel like watching different YouTube videos and talking to people who have gone through this or are going through this. Um, and getting their insight and their experience has been very, very helpful and beneficial. So I wanted to pay that forward and provide, what I experienced too, and hopefully some of this, any little bit, will help you along the way. And everybody's experience is different, and everybody's diagnosis and what they find along the way is different. There's a billboard on the freeway from my house along one of the main highways that says there's no such thing as like a routine breast cancer. And oh, how true that is. And I don't think you realize that until you're in the midst of it and you're starting to go through it. So for this particular video, I wanted to share information about my visit, the first visit that I had with a radiation oncologist. And I was a little surprised that I was going to be even meeting with a radiation oncologist, just because when I had done my initial consult with my breast surgeon, the options were to talk about lumpectomy plus radiation or going the mastectomy route, whether a single or double mastectomy. And I thought that by going the double mastectomy route, the mastectomy route in general meant no radiation. What she had said when we talked a little bit more after my surgery is she wanted me to talk to a radiation oncologist and or an oncologist radiologist. I can't remember I think they're radiation oncologists. And then also get me an oncologist, a cancer oncologist that I would have, from here on out that would prescribe the hormone blocker that I would be on for the next 5 to 10 years and, kind of monitor me from here on out. And so I was a little bit surprised and worried when she had told me I want to say it was a little over a week, maybe a week and a half, not even a week and a half after my surgery, that I had my follow up with her. And, or maybe 2 weeks it was, a follow up with my breast surgeon. And she had said she was going to refer me to a cancer oncologist and a radiation oncologist. So I was able to meet with a radiation oncologist first. And when I met with that doctor, he was very helpful. I didn't know what to expect. I even asked when the woman called to schedule with me, like what happens in this appointment? Because even in my mind, it was like I don't need radiation, or I'm not going to have radiation. And she said basically the nurse comes in, she does her assessment, and then the doctor comes in and talks about his recommendation of whether you need radiation or not. And if you do, how many sessions they recommend that you do. And so when I went in, my husband went with me and we went back and the nurse did an assessment, and it was really pretty thorough questioning of my history and just my health and everything like that, and then how I've been feeling since surgery. And she did an exam of my chest, and then she left and the doctor came in. And the doctor came in and he had talked to me and basically said, um, so my, he had looked at, so as far as he was concerned, he doesn't look really at the oncotype score, which is an assessment they do of the tumor or mass that's taken from you. But his is more looking at the size of the tumor and different criteria within, my cancer, the stage it was, and lymph node involvement and things like that. And the way that he had looked at it, he basically told me that he had reached out and consulted with several other doctors, at least 4 or 5, I think, to see if what their recommendation was, to see if he was on the right path or not. He said I fell, of course, into that gray area of not knowing, how beneficial it would be versus not. So when he talked to me, he basically told me that if I was to do radiation, I would have to do 5 weeks, 5 sessions a week. So that's 25 sessions of radiation. And I would start, unless I had to do chemo, I would start pretty soon, like within the next couple weeks, really, from that appointment. And he said that he talked about the risks. Some of the benefits to it is it can basically help improve your percentage of potential reoccurrence within that area. I did ask the question too about, okay, they found abnormal cells in my other breast, and he said since that's not cancer, they don't focus on that. They focus on the area, sorry, opposite side. They focus on the area that did have the cancer in it. So that would be where the radiation is. He said since that's on my right side, it would not impact my heart. There is minimal chance it could impact my lung. So some people through radiation, it's very minimal, but it could get other types of cancer. So in their lung or I can't remember what some of the other stuff is. It depends on where the radiation is on your body too. Um, he said also because it's in this area, and I take Synthroid generic for my thyroid, I have hypothyroidism, that it could impact my thyroid, but the mitigation for that is that your family doctor increases your milligrams or micrograms of what you take for your thyroid medication. That worried me a little bit because I went through a lot of things with my thyroid back in 2013. The other thing was that you can't significantly gain or lose weight. I'm on Weight Watchers, and not that I'm significantly losing weight through that, but I'm steady progression in what I'm doing. Because they mark areas. Sometimes people get like a temporary tattoo, like they take a pen and do a dot and a temporary tattoo. Others just do a marker kind of thing. So when they position you underneath the radiation machine, they know where to position you so you're the same each time. And if you gain or lose weight, that could impact, they would have to switch that up and change it. It could take more time, could be more cumbersome, that kind of thing. He also said that I would have to put off any fills to my tissue expanders and would not be able to have a tissue expander to implant surgery until quite a few weeks after the radiation was over. So that would extend my time frame, if it's 5 weeks plus a few more weeks, a couple more months. Did not like that either. The one thing that really turned me off about radiation, and I've heard good and bad stories of people who have gone through radiation, was the burning that can happen. And it doesn't happen immediately when you start radiation, but towards the end of those sessions and what it does to your skin. And there's also the probability that my plastic surgeon would have a more difficult time with the implant on that side when he goes to do that because the skin is so different. So that worried me a bit. I'm trying to think if there's anything else that he said. He gave me all of the information. We talked through all of those kind of things. I'm probably missing out a couple things. Let me check. I actually took some notes in my notebook when we were right after that appointment. But he basically said that based on his and the other doctors, he believed I had about a 10 to 15% chance of reoccurrence without radiation. So 10 to 15% recurrence rate without radiation. And if I had radiation, that would be cut in 2/3. So it would go down. To me, I was heavily going in there not wanting radiation, just knowing some of those different things that could happen. And I was still at that point when I walked out that I did not want to do it. For me, it was not significant enough. And I even talked to him about, am I going to have regular checkups? Like I hear people talk about going every 3 months. It's every 6 months to one doctor, every 6 months to the other, and it rotates. He said, absolutely, they would keep an eye on you. They would check things, any pain or ache or whatever, and then also doing exams and things like that. So they would keep a good eye on you. Let me just look through. I think that was it for him. So when I walked out of there, I was still in the mindset of not wanting to do radiation, just for several of the reasons that he talked about. And my husband and I had agreed to not make the final decision on radiation until after we saw the cancer oncologist and talked about chemo and talked with him about radiation and kind of see what should our game plan be. So that cancer oncologist is like your main doctor moving forward. So to talk to him and get his thoughts and everything on my case. So that's kind of how it was as I left radiation. So I will end this video now. The next video, I'll talk more about my visit with my cancer oncologist and what he told me based on my oncotype score. And I'll explain that a little bit more, as well as chemo and the percentage benefits, ovary suppression that we talked about, and then radiation and what that final decision was. So thank you for watching, and I hope you have a great day.